Hello ma'am, good afternoon. I am Liana Vigadi Malapira, your student nurse for today. Today I will be assessing your heart and neck vessels in order for me to determine any possible signs of heart problem. And kailangan ko po dito yung full cooperation nyo. Okay lang po ba sa inyo yun, ma'am?
Okay lang.
So, before we proceed to the assessment po, may I know what is your name, ma'am?
Sofia Guzman po.
Check ko lang po. And thank you po. So for the next step is to perform the hand hygiene or the medical asepsis. Next is to provide clients privacy by closing the doors and pulling the curtains. Next is to assemble equipment. And so we have the pencil case. Nandito yung mga kakailanganin. Before we proceed to the procedures po, may mga katanungan lang din po na itatanong po sa inyo. Okay lang po ba sa inyo yun, ma'am?
Okay lang.
So, may family history po ba kayo ng high blood,
Wala po.
stroke, ganun po? Wala naman?
Wala naman.
Okay. Before, ma'am, nakaranas na po ba kayo ng sakit sa puso, ganun po?
Hindi naman po.
Okay. Sa ngayon, ma'am, wala po ba kayong upo or nahihirapan po ba kayong huminga?
Hindi naman po.
Okay. Next naman po is yung lifestyle po ninyo. Before po, naninigarilyo po ba kayo?
Hindi po.
How about sa pag-inom ng alak po?
Hindi po.
So for the first assessment po is to inspect and palpate the precordium for the presence of abnormal pulsations, hips or lifts by locating the valves of the heart, which are aortic, pulmonic, and tricuspid and mitral. So ma'am, assess ko lang po kayo. So first is to locate the angle of Louis. Next is the aortic and the pulmonic. Down to the tricuspid. Next is the mitral or the apical. Okay po. Next is to inspect the aortic and pulmonic for pulsations. So, assess ko lang po kayo ulit. Next naman is to inspect and palpate the tricuspid for pulsations. Lastly, the mitral or the apical. Next is to inspect and palpate the epigastric area. So ma'am, assess ko lang po kayo na, palpate ko lang po. So for the second assessment is to auscultate you na ma'am. So, in this procedure, kailangan po nakahiga kayo. So, okay lang po ba sa inyo ma'am?
Okay po.
Sige po. Okay, for the next assessment, I will be auscultating the heart in a 4 anatomical sites, which are the aortic, pulmonic, tricuspid, and the mitral. Make sure that the room is quiet and make sure din na yung patient is nasa supine position, elevated 30 to 45 degrees. Okay, so for the next is in a upright sitting position naman. So ma'am, upo po tayo. Next is to auscultate the carotid area. Ma'am, po tayo. Yung ulo po. Kabila naman po. Next is to palpate the carotid artery. Paano lang po yung ulo? Next po. Next naman po is to inspect your jugular veins, pero naka semi-fowler's position po tayo. So next is to inspect the jugular vein for distension. So if a jugular vein is present, you have to assess the jugular vein by locating and measuring the highest point of distension. So, ma'am, are you still comfortable?
Yes po.
Okay pa po ba tayo? Okay. Thank you po for your time, effort, patience, and cooperation po. After assessing the patient, you have to document all the findings.